Hi everyone. Today in this video let us discuss mometasone. Mometasone is one of the glucocorticoid which can be given in the form of mometasone furoate. In this ester form, mometasone can be used as topical corticosteroid. This drug is available in different dosage forms such as ointment, cream, solution. All these are given by topical route. And here mometasone acts as anti-inflammatory agent. So this drug can be indicated in the treatment of inflammatory skin disorders such as eczema, pruritus, where itching, swelling and redness of the skin can be observed, atopic dermatitis, even psoriasis. In all these skin disorders, mometasone furoate can be used by topical route to reduce the inflammation, swelling and redness of the skin. Apart from these skin disorders, mometasone furoate can be used as nasal spray for the treatment of allergic rhinitis. But today in this video, we are going to see how this mometasone is used as topical corticosteroid. One of the advantages of mometasone is that it can be applied on the skin where irritation persists. So by administration of mometasone, it can be absorbed into the skin, which reduces the inflammation and swelling. But few of the molecules of mometasone can be absorbed into the skin where they can be transported into the systemic circulation, but this is somewhat less in case of mometasone furoate. Even the systemic bioavailability of mometasone is somewhat reduced by the liver. Even though this drug shows very less systemic absorption, few of the molecules can enter into the systemic circulation, but they are metabolized by the liver. So these molecules, when enter into the liver, they are going to be metabolized to produce inactive metabolite. So due to extensive metabolism and less systemic absorption, mometasone furoate is mainly used as topical route and it is having very less systemic exposure, resulting in the decreased systemic side effects of mometasone. So this is one of the advantages of mometasone furoate, which can be used by topical route with less systemic side effects. Now let us see how this drug acts. Mometasone can act on the glucocorticoid receptors which are present within the cytoplasm. These glucocorticoid receptors are coupled with one of the protein HSP90, heat shock protein 90. And since mometasone is a steroid, it acts on the nucleus and interacts with the DNA. Now when mometasone binds to glucocorticoid receptors, they are activated and they can be internalized into the nucleus where heat shock protein is separated. Within the nucleus, these glucocorticoid receptors are going to be dimerized, which produce the beneficial gene transcription. Thereby they can produce mRNA. This mRNA codes for anti-inflammatory mediators which can undergo translation within the ribosome such that it can produce few of the inflammatory mediators such as lipocortin-1. This lipocortin-1 and annexin A1 can reduce the synthesis of inflammatory mediators. So in this way, mometasone can control the synthesis of inflammatory mediators by enhanced gene transcription of anti-inflammatory mediators. Similarly, this gene transcription can also inhibit the release of IL-2, interleukin-2, which promotes the inflammatory response. And finally, mometasone can also inhibit the response of inflammatory mediators so that they can stimulate NF-κB, nuclear factor kappa B. This NF-κB can interact with the DNA to produce gene transcription, which results in the release of inflammatory mediators. So this produces inflammation within the cell, which is again controlled by mometasone. Now this mometasone occupied on the glucocorticoid receptors can interact with the DNA and it can inhibit the action of NF-κB. In this way, mometasone also inhibits the gene transcription of inflammatory mediators. Within a cell, when there is an inflammatory stimuli, it can release one of the important mediator, phospholipase A2. This phospholipase A2 can interact with the phospholipid membrane so that it can cleave the phospholipids into one of the mediator, arachidonic acid. This arachidonic acid is a C20 fatty acid, which is the important precursor for many of the inflammatory mediators. Now, COX is another enzyme which can interact with this arachidonic acid such that they are going to be converted into various mediators such as prostaglandins and thromboxanes. So, PGE2, PGI2 and thromboxane A2, all they can produce inflammation, resulting in the swelling, redness and itching of the skin. Now, mometasone can stimulate one of the mediator, annexin A1. This annexin A1 can control the action of phospholipase A2, thereby it can reduce the synthesis of prostaglandins and thromboxane. Similarly, mometasone can also inhibit the activity of COX pathway so that it can inhibit the synthesis of prostaglandins. By all these actions, mometasone can reduce the inflammatory response. Now let us see the precautions of mometasone. Since this drug is going to be applied on the skin, it can produce some skin reactions resulting in allergic contact dermatitis. So mometasone can increase the redness of the skin within the hands due to any allergic response. When skin irritation persists, this mometasone should be discarded. Mometasone can inhibit HPA axis, resulting in the decreased release of cortisol. So this may produce the symptoms related to adrenal insufficiency. But since mometasone is given as topical route, suppression of HPA axis is somewhat less observed. For instance, when this mometasone is applied at high dose such as 15 grams twice daily, then it can produce significant suppression of HPA axis. But such dose is not applied at therapeutic level. So at normal doses, this drug may produce less HPA axis suppression. Now let us see the side effects of this drug. Mometasone Furoate can produce local reactions resulting in burning, stinging, skin irritation, boils on the skin, and contact dermatitis can be produced by this drug. Now let us see the chemical nature of this drug. So this is the structure of mometasone. How it is given? This drug is available as ointment at a strength of 0.1%. It is also available as cream, solution, and this drug should be applied once a day on the affected area to reduce the inflammation. Since mometasone is a potent corticosteroid, it should be used only for 2 weeks. And when inflammation persists for more than 2 weeks, this drug should not be used. So that's about this drug Mometasone Furoate, which is a topical corticosteroid. So that's about this drug Mometasone Furoate. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.